Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 73020 Radiologic Examination Shoulder 1 View, 73030 Radiologic Examination Shoulder Complete, minimum of 2 views. These views are used to evaluate the shoulder joint, clavicle, scapula, proximal humerus, and surrounding soft tissues. CPT code selection depends on the number and type of views performed. Grouped by clinical focus, standard views, AP neutral view, AP internal rotation, AP external rotation, fracture and joint evaluation lateral scapula Y view, AP glenoid, Grashy, axial view, Garth, orthopedic specialty views, outlet view, near, AP axial notch view, Stryker, West Point view, Velpo view, radiology report order exam shoulder 1 view, right, header AP neutral view of the right shoulder, history, injury, comparison, none available. Findings, anterior inferior right shoulder dislocation, probable humeral head Hill-Sachs impaction deformity. Impression, anterior inferior right shoulder dislocation. Let's look at the views. AP neutral view, that's a total of 1 view. This qualifies for CPT code 73020. This is an anterior inferior shoulder dislocation. A probable Hill-Sachs deformity is described but not confirmed as a separate fracture. Hill-Sachs deformity represents an expected impaction injury associated with anterior dislocations. Correct ICD-10-CM code S43.014A, anterior dislocation of right shoulder joint, initial encounter. The A character is used because this is the first evaluation and treatment phase during the emergency visit. The correct codes for this report are CPT 73020 right, radiologic examination, shoulder, 1 view, and ICD-10-CM code S43.014A, anterior dislocation of right shoulder joint, initial encounter. Radiology report, order exam, shoulder minimum 2 views, right. Header, AP internal rotation and Y views of the right shoulder. History, dislocation post-reduction. Comparison, 01/28/2023 at 19:13 hours. Findings, successful reduction of the right shoulder. Humeral head, Hill-Sachs impaction deformity is identified. Impression, reduction confirmed, stable appearance. Humeral head Hill-Sachs impaction deformity. Let's look at the views. AP internal rotation, scapular Y view, that's a total of 2 views. This qualifies for CPT code 73030. Now let's choose the appropriate diagnosis code based on clinical history and chart findings. Report findings state, the patient has undergone successful reduction of a dislocated shoulder, and a Hill-Sachs impaction fracture is confirmed in the findings and impression. A Hill-Sachs fracture is a compression fracture of the posterolateral humeral head that occurs when the shoulder dislocates anteriorly. It is caused by the humeral head impacting against the glenoid rim. It's often associated with recurrent dislocations or instability of the shoulder joint. Since the fracture is documented clearly in the findings as an active post-traumatic injury, we must code it as a traumatic fracture, not as a deformity or incidental finding. Chart review confirms that this exam occurred during the same day emergency encounter. The patient is still in the active phase of treatment, so we apply 7th character A. The correct ICD-10-CM code is S42.291A, other fracture of upper end of right humerus, initial encounter for closed fracture. This code reflects the Hill-Sachs fracture of the right humeral head, occurring in the setting of trauma and dislocation. The A 7th character confirms initial encounter for active treatment. The correct codes for this report, CPT 73030, right, radiologic examination, shoulder, complete, minimum of 2 views, and ICD-10-CM code S42.291A, other fracture of upper end of right humerus, initial encounter for closed fracture. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association (AMA). CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.